So welcome everyone to our third and final webinar on the return to work and duty to cooperate draft policy specifically. My name is Katie Clark. I am a communications advisor with the Workers' Compensation Board of Nova Scotia. And I am joined today by Kevin Foster, our Manager for Strategy, Support, and Planning. And in just a little sec here, Kevin is going to lead us through a presentation on the draft policy. And if you've attended our presentations or our webinars before on the draft policy, this is the exact same agenda, but we just want to offer the different times just based on your schedule and what would be easiest for you to attend. And the draft policy is open until April 28th. So you still have tons of time to give your input and your feedback on it. And Kevin will give you more details on how to do that in just a short while here. And just as a reminder, these webinars are always very topic focused. So this one is on duty to cooperate, the duty to cooperate draft policy. So just keep that in mind that any questions related to a specific claim, this would not be the appropriate forum for that. We encourage you to bring that up with your caseworker or our client relations officer. Mics and cameras will be off for the duration of the session, but as always, we have our Q&A at the end of the session. So please feel free to post any questions that you have on the draft policy into the chat box, and you can pop those in at any point during today's webinar. And we do have two moderators today who will be helping to man that chat box, and that is Sarah Lafergie, who is a relationship manager with us at WCB, and Paul Donovan, a workplace consultant. And so they'll be helping us out. And I think that's it for me. So without further ado, you probably know him by now, over to Kevin Foster. Take it away, Kevin.
Thanks, Katie, and thanks everybody for participating today. So yeah, I just want to start off thanking everybody for taking some time out of your busy day to participate in today's webinar. I'm not sure what our final numbers are for today that logged in. I can't see it here now that we've started, but there's been a number of people that have participated, so we're really thankful for that. Some of you that may be on today's webinar may have been on the previous one that I did on March 27th. This will be a bit of a duplication of that, so we'll be covering a lot of the same work and same information that I did at that webinar. But as Katie said, we'll have some opportunity for some Q&A at the end, so that if there's any new questions, we'll cover it off of that as well. So today we're here to really talk about a policy consultation that our board of directors initiated as part of our commitment to you to be open, transparent, and accountable for the work that we're doing at the Workers' Compensation Board. And before I really get started into all of this, I just want to say that by you participating in this webinar, it tells me that you, like us, are looking for the same thing, and that's Nova Scotians working. And currently in Nova Scotia, after a workplace injury occurs, the time away from work is far too long. There can be a lot of reasons for that, but that's the reality. And as a system, that's something that we need to improve on. All right, just clicking a few buttons here, sorry. So as far as today's webinar, the purpose of today's webinar is I want to provide a bit of an update on some feedback and comments that we've received to date from participants like you and some of the common questions that we're getting about the consultation document. I'm going to respond to some of those questions and gather additional feedback that you have either through the chat or if we can get to it in the Q&A as well. We're going to specifically be covering two different topics. We're going to be talking about our new return to work duty to cooperate suite of policies. So there's 3 policies in that section of the document that we've shared in advance. And I'm also going to be talking about some revisions that our board is proposing to our policy around how we do consultations with stakeholders. So I'll cover off that briefly as well. Before I get into kind of really the presentation overall, I just want to remind everybody kind of where the Workers' Compensation Board and the Board of Directors falls in the role of kind of the governance of the whole Workers' Compensation Act. So the Workers' Compensation Act is a piece of legislation that is approved through the legislature and is done by government. So anything that is legislative in nature requires government to update, make changes, and so on. The government also has the ability to create, through cabinet approval, workers regulations related to the Workers' Compensation Board. And then underneath that comes the Workers' Compensation Board itself. So our board has the responsibility for the administration, the delivery of the Workers' Compensation Act. And within that legislative authority, the board has the ability to create policy. And policy then forms part of the overall Act regulations and the administration of the WCB. That's where our board obviously helps to provide some clarity around what it is that we need to explain to people in the delivery of the Workers' Compensation Act. And so that's really what these documents that I've sent out for consultation is really all about. It's the board's view of what we need to help administer the legislation of the Workers' Compensation Act itself. So why are we here? Well, we're here because there were some recent changes to the Workers' Compensation Act, and that change introduced a new duty to cooperate for both employers and workers. And the duty to cooperate that has been added to the Workers' Compensation Act is really around that acute phase of an injury, when a worker's still recovering from the workplace injury, in the hopes that they can maintain employment or return to employment while they're recovering, so that there's not a need to be staying at home, recovering, and then looking for ability to get back to work. That legislation that changed the Workers' Compensation Act was through a bill called the Stronger Workplaces for Nova Scotia Act. And I won't get into it in great detail, but it outlines a number of the responsibilities that all come into effect under the Workers' Compensation by July 15th of this year. So this is why we're out now looking to develop some policies to help provide some clarity around what it is that we're going to need to help administer that new legislation. But overall, as far as the duty to cooperate at a high level, it's really about workers and employers maintaining communication throughout the whole period of the worker's recovery, right until they get full return to work. It's about collaboration, identifying and providing suitable work that's available, and keeping the WCB informed of that progress that people are making and concerns that might be coming through the return to work process. The WCB obviously plays an important role in that as well. And that's really about ensuring that that collaboration between the worker and the employer is happening, that we're proactively out working with employers and workers to resolve issues during that recovery phase, and to ensure that any actions that we need to take to help with compliance around the duty to cooperate is being looked at. So it's really an important multi-faceted process. It involves employers, workers, WCB, and healthcare providers. And I'll talk a little bit more about that when we get into some of the questions here later. So as far as the legislation goes, the legislation, as I said, is going to come into effect July 15th. In order for us to get ready to administer that legislation, we've drafted some new policies that we are putting out for consultation. That's what I'm here to talk about today. Everybody that's on this call, I imagine by now has seen it. If you haven't, though, it's available on our website. We'll include some links in the chat here later if you want to go to see those documents. But it's really about those policies that I'm here talking about today to get us ready so that when July 15th comes along, we'll have policies in place. We'll know what the rules are around administering the duty to cooperate. First thing, though, I want to really talk about is really where this new requirement of duty to cooperate fits in the overall scheme of return to work at workers' compensation. So we've developed a bit of a graphic to try to help explain that for everybody. And the first thing that I want to stress is that return to work is something that happens at the WCB day in and day out. With every injury, we're working with employers and workers around return to work. And return to work crosses the whole time from the time the injury occurs right through to some resolution in that claim of either helping the worker get back to work or potentially getting on to benefits if the inability to get back to work. So return to work is the overarching process of maintaining and re-engaging workers in safe and timely, meaningful work that helps to eliminate or minimize their wage loss as soon as it's safe to do so. This new legislation, though, that passed is really requiring employers and workers to cooperate in that early phase of the workplace injury. So from the time the injury occurs through to the recovery of the injury. So that really acute phase of the injury is what this new duty to cooperate is really talking about. There are a number of other tools that the WCB has to help people return to work. And many of you may be familiar with reemployment obligations, vocational rehabilitation, abilities to estimate earnings, and so on. Those are all part of the overall return to work process. But the three policies that I'm going to talk about today around duty to cooperate is really that front end of the claim, when the claim first happens, when a worker's still in that acute recovery phase of that injury. So as far as the board directors is looking, obviously, to engage parties in this consultation process around the draft policies that we are putting out for consultation. And we're looking for that feedback to help us to operationalize this legislative amendment on the duty to cooperate. As I mentioned before, we've issued a background document with the draft language and the policies that we've shared on our website under our policy section under what's new. I'm sure somebody here, as I'm talking, will copy a link in if you don't already have that. We would have also sent that out to any participants that are on this call who have signed up for our policy notification system. So if you don't regularly get updates around our policy consultations and work that we're doing in policy, if you click into our corporate website under our policy section, there's the ability to sign up there to get notifications. So it's a great way of staying in touch with what's going on from a policy perspective, and you'll automatically get sent stuff as we update or make changes to anything that's going on from a policy. I do want to thank, though, everybody that has participated so far. We've received a number of questions and feedback, which has helped to kind of form this presentation today. And so as I talk about the questions that we've already received, if there's additional stuff that people are looking for clarity on or feedback that they want to provide, hopefully we'll get to some of those during the open Q&A. If not, you can certainly send them to us directly. In a slide later on, I'll explain different ways that you can send that feedback to us. But there's a number of different ways that we can get that, and we're looking forward to hearing that. It helps us to inform and understand if the policies are clear and concise and helpful for people to know what the intent is, and it really helps to make us finalize that document in a stronger way. So getting into some of the questions that we've received so far, we've tried to take the questions as they come in. We're kind of bucketing them into themes of common stuff that people have been asking. And so I'm going to go through a number of slides now where we've received a number of questions on this, on issues, and I'll try to provide some clarity on what it is that we're doing with that or how we view it. And then, like I said, we'll get into kind of the open Q&A part. So the first thing that we've had some questions about is really around, well, the application of this policy, who is it meant for and when does it start to apply? So from a who perspective, duty to cooperate is really for all covered employers and workers that are registered within the workers' compensation system. So that includes, for those of you who know and understand what reemployment is about, it includes any employers that also have an obligation under reemployment. So unlike reemployment, who has some criteria where certain employers of a certain size, if they're below 20 workers, or if you're in the construction industry where reemployment doesn't apply, duty to cooperate doesn't have that criteria. It's for all size employers and all sectors. As far as the when, the legislation changes come into effect July 15th. So the policies that we've put out for draft consultation, we'll be finalizing them. We'll be taking them back to our board for final approval, with obviously the effective date of July 15th to coincide with the legislative change. The other thing that we've been getting questions about is, well, when July 15th comes along, the policies are now finalized, the legislation comes into effect. What happens with existing claims that maybe are already with the Workers' Compensation Board? So people that have filed a claim, maybe they're in a wage loss situation prior to July 15th. Will the duty to cooperate requirements apply to those claims? And the simple answer is yes. If those claims are still kind of in that early phase of the injury, they're still in that acute recovery portion, then we'll be looking to try to find ways to ensure that workers and employers are working together to, again, look for accommodations and cooperation in return to work. So it's not just net new claims happening July 15th, claims that are already on the book, so to speak. If they're still in that kind of that recovery acute phase, then duty to cooperate will definitely apply to them as well. We've had some questions around feedback on kind of the role and accountability of the WCB itself in this whole process, and some feeling that it wasn't clear around what role the WCB plays. And I just want to point out, the WCB plays an important role in this overall process, but it's really from a facilitation perspective. So the ability to create opportunities for accommodations with workers at the workplace is not something that obviously the WCB has, because it's not our workplaces, but we need to work together to ensure that facilitation of all that communication is happening between the parties, to ensure that opportunities are being sought and people have the ability to try to stay at work or recover from the injury while they're maintaining some connection to the workplace. As far as outlining our role in all of this, there's, of the policies that we've proposed, two of them in particular, 571, really outlines the return to work process overall. And in the Workers' Compensation Act, in the section 1A, it speaks to the mandate of the WCB to facilitate the rehabilitation and safe and timely return to work for workers, and to maintain and to sustain work-related, sorry, I'm just getting a bunch of pop-ups here. Sorry, work-related injuries. So first of all, under that broad statement in the Workers' Compensation Act, we've called that out in policy 571 to outline that that's an important role that the WCB plays in facilitating that return to work. Then within 572 policy, we set out specific roles and responsibilities that the WCB has in that early and safe return to work in more detail. But again, as people review these policies, if there's some concerns, you don't think something's clear, then that's the type of feedback that we're looking for. So please continue to send that in if you have questions or concerns around how any of that's worded. We also had some concerns raised by employers in particular, that they didn't feel that the draft policies were clear, that the employer was part of the return to work team. Now, we've gone back and we've looked at the definition, the way we've drafted it, and we certainly want to assure everybody that that's not true. Employers clearly are part of the return to work team. We feel that the definition did include that, but we're certainly going to go back and we're going to look at it. If we need to tighten that up a bit more or be a bit more explicit, then we're certainly going to do that, because there is no doubt that employers and the workers of these situations are key participants in the return to work team, and employers play a vital role in all that. The other question that we had from the employer perspective is, a number of employers, and maybe some of you on the call today, use third-party service providers to manage your return to work and your WCB claims. And there was a concern that in those situations, does the worker have a responsibility to deal with third-party provider, to cooperate with them just like they would the employer? And again, the simple answer to that is yes. In workers' compensation, if we know that an employer is using a third-party provider, we request clarity on that. We make that notation in the file so that we know who that third-party provider is and that they've been authorized to kind of step in as the employer in managing that claim. And so from our perspective, then, we haven't specifically called out third-party providers as a role or responsibility in these draft policies, because in those situations, they are the employer, and we'll have that documentation on file. So simply put, a third-party provider acting on behalf of the employer is the employer from a roles and responsibilities perspective, and we would expect that the worker and that third-party provider are working together just like a worker and the employer would in those situations. Also had a lot of questions about roles of unions and how they fit into the involvement in the return to work process. And we just want to make it clear that unions play an important role in return to work. The feedback that we've received, though, expressed some concerns that the unions maybe are not participating the way they should in return to work, or not helping with that return to work process. Again, the policy calls out some roles and responsibilities of various parties, including the union. That's outlined in our policy 572. We think that the call out of those responsibilities of the union do reflect kind of the Supreme Court findings that duty to cooperate is a shared responsibility, and unions have a positive responsibility to support accommodations and return to work efforts. But again, you know, if there's other specific words that people are concerned about or it's not clear, that's the type of feedback that we're looking for. But we did also have some specific concerns around there was nothing in the policies that talk about us directing as a WCB or talking about penalizing a union if something was going on. And I just want to be clear, there's no authority within the legislative change or the policies that we are proposing that would allow us to direct or penalize unions. Unions provide an important role in return to work in supporting their union members, but there's no authorization for penalizing or directing unions through the legislation. The second part around unions that we got some feedback on is that it was noted that we didn't include any reference to collective agreements in the policy and that we should look into that. And I just wanted to state that today in the Workers' Compensation Act, it's clear that if a collective agreement and the act conflict, whatever offers the better outcomes for a worker always prevails, with the exception of seniority provisions that are set out in the collective agreement, that always prevails. The reason, though, that we didn't initially include this in the draft policy is that the duty to cooperate is really about that acute phase of the injury. So it's more of a temporary type accommodation while the worker is recovering. We didn't necessarily think it was pertinent in this situation, and that the longer term accommodations where potential conflicts may arise between collective agreements and the Act is more likely in the longer term accommodations where seniority may become an issue. But that's certainly something we're going to go back and look at. And if we think that that clarity is important in the policy, we'll certainly be considering that before we propose the final draft language to our board for approval. We also got some questions around what happens when the employer has developed a return to work plan and the worker refuses. Well, the introduction of duty to cooperate really means that the employer should feel empowered to communicate with the worker around their responsibilities in cooperating and accepting suitable and safe work that is offered to them. It's also clear in the legislation and the policies that the role of the worker is to obviously cooperate in this process and to look for those ways of reducing the workplace injury and getting back to work. So a worker not willing to cooperate or refusing to participate in a return to work plan would really have to have some compelling reason not to accept the situation. Otherwise, there's the potential that they're not then in compliance with their duty to cooperate. But ideally, our goal and our role and responsibility in this whole duty to cooperate process is that we need to facilitate those discussions. So if there's some concern between the worker and the employer around the accommodation that's being provided or an ability to do that accommodation, that's something that you really should be talking to the caseworker about so that options can be explored and things can be figured out before we go down a route of somebody being not in compliance with their duty and the responsibility around duty to cooperate. So we would strongly encourage that if there's information that needs to be clarified, that's part of the return to work team, which includes your caseworker, the employer, the worker, their union, if there's a union in play, and any healthcare providers, that's part of the claim as well. We also have had a lot of questions around suitable work and what does suitable work mean, especially in the context of duty to cooperate and reemployment. So as I've been saying, duty to cooperate, the new requirements are really about that early and safe component of the return to work process. So the front end of a claim, when the injury first happens, when the worker's still kind of in that acute recovery phase. And so from a suitable work perspective and accommodation, these accommodations are likely temporary type accommodations. So it's not about necessarily, I have to have a complete full-time available job in order to accommodate somebody. We might be looking for accommodations that have bundling of different responsibilities or tasks that need to be done at the workplace temporarily while that worker's recovering. Whereas when it comes to the use of the term suitable work, when it gets to reemployment really starts to kick in when a worker's kind of plateaued in their recovery. So they've now reached some maximum medical recovery. And if we get a situation like that and the worker's not already back re-engaged in work, suitable employment, or suitable work, I should say, takes a bit of a different context. And suitable work in that situation is when the workers reach that recovery phase of their injury and they're unable to potentially return to their pre-injury job for some reason. So the pre-injury job or the essential duties of that pre-injury job are not available to them because of the workplace injury. If there's a duty then of that employer to re-employ, and if they're not already back to work, then suitable work is something that is a responsibility under re-employment. And suitable work then at that point really is talking about a job that's available for them to do. That's an actual job that fits within their functional abilities and is safe for them to do. So it's really about a job at that point. So the difference between those two, as I said, suitable work is used in both duty to cooperate and reemployment, but really in the duty to cooperate, it's the temporary phase, the recovery phase of the injury, and in reemployment, it's when that recovery has occurred, and now we're looking for something more that's ability to bring them back on a permanent basis, because that's now kind of where they're going to be in their state after they've recovered from the injury. But the one thing I want to make clear, it's clear in our reemployment policies, if you're familiar with them, and it's certainly something that we want to make sure that people understand under duty to cooperate. In both cases, the employer is not required to create work. So whether it's work task or whether it's a job, it's work that needs to be done. It's work that's meaningful, that is work that the employer is expecting somebody to do. And if it's the ability that while the worker is recovering from the workplace injury, they have the skills to do it, then that's what we're looking for. But it's not about making up jobs or asking somebody to come in to do work that is not work that the workers that the employer needs to do. So an example that people often talk about is, well, I'll bring somebody back just to get them at work, and I'll make them count paper clips all day long, and then tomorrow they come back in and they got to count those same paper clips. Well, unless you've got a type of industry where you count paper clips, that's not an actual job. It's not a task that you can just bring somebody back to or say, well, I'm trying to accommodate them in to do this work, and so therefore they're not participating in their duty to cooperate. So it needs to be work that is meaningful, and it's work that needs to be done, and it's not work that's just being created for the purposes of bringing somebody back. I got a million different pop-ups happening here for some reason. I don't know what's going on. The other thing around available work that we got some feedback on was we talk about available work in the draft policy, the 573, in particular in section 2 of that policy. And in there, we say available work is work that exists with the employer at the time of the work-related injury. And we've received some feedback that the words at the time of the work-related injury is a bit confusing and maybe is not really what we were trying to get at. There was a concern that, at the time of the injury, the type of tasks and work that the worker might be doing is not something that they would be doing a week or two later. And so how can we then accommodate them if it's not work that we have available at the time of the injury? That's not really what we were getting at. So the comments that we were getting back was, well, shouldn't this really be saying available at the time the return to work is attempted? So there's definitely something there. We need to provide some clarity. We're going to take a closer look at that. But the whole philosophy around early and safe return to work is that most workers should be able to recover at work, and there won't be large gaps between the injury and when the worker's back on the job. But that may not always be the case. And in those situations, there might be situations where the type of work that was being done prior to the injury is certainly not work that's available at the time of injury, and that work might be different. But that's kind of something we just need to clarify. So we're definitely going to be going back and having a look at that section and making sure we can kind of clarify that a bit better. The other thing that we've received some feedback on is around penalties. And in particular, penalties when there's no work available. We received a lot of questions around the statement describing penalties and how we might impose them. And I guess I just want to be clear that if there's genuinely no work available, we're certainly going to try to work with the parties to look for creative solutions to see if there's other ways that we can find work, or even, some modified work or some kind of temporary way of helping to reduce the impact of the injury. But if there truly is no available work for the worker to do while they are in their injury state, then obviously we're not looking to penalize an employer if they truly don't have work available. But there's a big difference between not having work available and not willing, or saying you just simply can't accommodate. Can't accommodate is something that we need to then look at. And is that really something that needs to be considered in the context of undue hardship? Because accommodations sometimes can be difficult and challenging, but there's a difference between, not willing to accommodate or saying you can't accommodate versus there truly is no work available to bring the person back to while they're recovering. The other thing from a penalty perspective, there's a feeling that we need to provide a bit better clarity around the penalty section and how we're going to impose that penalty, what the amount of that penalty can be. And I just want to be clear, though, the legislation that comes into effect makes it pretty clear that we have the ability to impose a penalty specifically to an employer if they're not complying with the duty to cooperate, up to the total cost of that claim. So at any given time, the legislation provides the authority for the WCB to assess a penalty for the total cost of the claim during that non-compliance period. And the total cost of the claim can certainly be anything from the wage loss that we've been paying to the worker while they're unable to work, the medical aid benefits and healthcare that we might be paying, and anything that might be related to that. But there's a feeling that it's maybe not as clear as it should be. We've gone out, we've looked at some of the other jurisdictions that have duty to cooperate legislation as well, and how they've structured some of that penalty system. So we're going to be looking at that again and trying to provide a bit better clarity around what we mean and how those penalties will get assessed and imposed if it needs to happen. But again, I just want to make it clear, the intent of this policy and the intent of the legislation is not simply just to be a penalty process where we're just applying penalties. It's trying to find cooperative ways, creative ways to keep people engaged in the workplace so that they can recover while they're working, as opposed to staying at home, then recovering, then talking about return to work at that point. The longer you're away from work, the tougher it becomes to kind of return back to that workplace. So staying engaged and keeping them at work is clearly what this duty to cooperate is all about. The last thing I want to kind of explain before we kind of jump into some Q&As here in a second is there's two parts to this consultation that we're out doing right now. There's specifically the policies, the three policies around duty to cooperate in that legislative change that's coming into effect by July 15th. But we're also out looking for feedback on some proposed changes that the board is looking around our consultation process. So the board is proposing to make some changes to that policy around consultation. Today, it's a very restrictive policy. Every time we go to make a change, whether it's something as simple as a typo, there's a whole process that we go through. We post a document, we look for feedback, and it takes a lot of time and effort. The board is looking to try to be a bit more efficient and focus consultation efforts on substantial policy changes as opposed to some of these minor changes. But I guess I just want to make it clear, though, in all of the proposed changes that we're talking about, regardless of what may happen in a policy, the board still has a commitment to be open and transparent around informing people of any of these changes. So it's not that policies will just get changed and there'll be no awareness or line of sight of what's happening. It's just that in certain situations, if the policy is not something that really requires a significant consultation or input from participants, that there will be the ability to make those amendments, document them, and then communicate them out to participants like you, so that you have awareness that those changes have been made, as opposed to then taking up your time, holding webinars, seeking your feedback, written feedback on stuff that maybe just is not a good use of everybody's time. As far as getting involved, though, still lots of time to get involved. As Katie mentioned, kind of this is our third and final kind of open webinar around the policy consultation process itself. But still, the policy consultation is open till the end of April, 28th of April. the ability to continue to send in any feedback that you have through a variety of ways here in a second that I'll explain. We would certainly still encourage you to do that. We're monitoring all of those sites on a regular basis and responding to input as we get it. So don't feel like you need to wait and submit a big submission by the 28th. You can certainly send it anything you have concerns along the way. But beyond this being the final policy consultation, there's a number of other webinars that we're going to be holding between now and July 15th around getting ready for duty to cooperate. But I just want to make it clear, as far as the policy itself and the discussion that I've been having, this will be kind of our final policy final webinar specific to the policy, but lots of time still to provide any input that you may have around the policy process and questions that you may have. So I would continue to encourage you to kind of send those through. You'll receive other information though about the other webinars that we'll be hosting in April, May, and June, leading up to the duty to cooperate legislative change by July 15th. So stay tuned for that. So what can you do now to get prepared? Well, the one thing I guess we just want to stress is you don't need to wait for the policies to be released. You can get started today. There's lots of ways of getting involved. There's going to be other opportunities, as I mentioned, about other webinars that you can certainly participate in. We're collecting feedback and input from people in a variety of ways as well that we're responding to on a regular basis. We're updating our website under our Duty to Cooperate section, where there'll be more information as we receive it. So I would suggest, explore our Working to Well resources, our employer toolkits, talk to your WCB rep around how you might be able to start to look at accommodations and return to work for people who have a workplace injury, and get creative. Think outside the box. I mean, there's lots of times that people say, well, I can't accommodate, but then as you talk it through and work with the return to work team, well, maybe there is the ability to accommodate. Maybe you can't bring them back to full wage loss, but maybe you can bring them back on a part-time basis while they're recovering from the workplace injury. So I guess we're just saying, get creative, look at ways of trying to keep people engaged to help reduce the cost of and the impact of a workplace injury. We're going to be ready by July 15th, and we want you to be ready as well. So questions that you have and concerns, by all means, continue to send them in, and we will continue to address them either directly through correspondence that you're sending in or through some webinars that will still be coming up. So as far as ways that you can continue to provide your feedback, I've mentioned there's been a bunch of different ways. You can certainly continue to use the QR code that's on the screen right now. That allows you to submit any feedback and questions that you might have about duty to cooperate, the policies themselves, or anything related around just the duty to cooperate process. Additionally, we have the consultation documents that are on our website. If you go to the website and you look at those documents, in the documents, there's a couple suggestions as to how you can continue to provide feedback. One of those includes sending it to our general policy mailbox, so policy@wcb.ns.ca. That's in the document as well. So a variety of different ways to send that feedback. And I would say strongly encourage anybody that if you have questions or concerns, that you continue to send that feedback. It's helping us to inform, the final policy document as we kind of get closer to the end of the consultation period. So keeping in touch, as I just mentioned, a few different ways. So again, there's the QR code that you can click on or use the picture to then submit any feedback that you may have. You can certainly send an email to the policy team at our policy address or the Duty to Cooperate webpage, where we'll be continuing to update on a fairly regular basis information as we kind of develop it to get us ready for the Duty to Cooperate changes by July 15th. So I'm going to stop there. We got about 20 good minutes now for some open Q&A. So I'm going to pause and turn it back over to Katie and see if we've got some questions coming from the chat.
We have lots of questions in the chat and some new ones too, which is always nice to see. And very interesting too, because we have questions kind of related to the worker's perspective. We have questions related to the employer. So we have a question actually from Rachel Barber, and just for context, Rachel Barber is a worker counselor with the Nova Scotia Federation of Labor, just for the room. And Rachel's question is a very interesting. It relates to Section 93 of the Workers' Compensation Act. So just for the room, Section 93 specifies that if a worker declines an offer of reemployment, the employer is relieved of their obligations. So that's in the Workers' Compensation Act. And Rachel pointed out, we obviously don't want workers losing their jobs. So how does Section 93 of the Act, how does that correlate with early and safe return to work? And the point in the Act where it specifies that if a worker declines an offer of reemployment, that the employer is relieved of their obligations. But obviously, we're talking about duty to cooperate with early and safe return to work. How do those two things meld together?
Yeah, so if you go back to the chart I was showing, where duty to cooperate is really about that initial phase of the injury, reemployment in that Section 93 is about once you've kind of reached the recovery of your injury. But as far as duty to cooperate goes, it's clear in the legislation and hopefully in the policies that a worker has a responsibility to cooperate in kind of that early and safe return to work. If there's accommodations or temporary modified work being offered to them, if it's deemed that that is a true bona fide offer and they're just not looking to take that offer, then it's also clear in the legislation and the policies that the worker potentially could be not in compliance with their responsibility to the duty to cooperate, and then could be subject to their claim being either temporarily suspended, loss of earnings lost for a period when they're not willing to cooperate in that return to work. So the section that Rachel's talking about is specific to reemployment. These policies that I'm here talking about today aren't specific to reemployment. Reemployment at that point under Section 93 is really about relieving the employer then to say, well, they don't have to continue to try to reemploy if the workers refuse. But that's something separate from duty to cooperate. So, but I'd gladly follow up with you, Rachel. If you want to give me a call, we can talk about it later.
That's great. Thank you, Kevin. And flipping over to Tom Champion, and for our participants, Tom Champion is an employer advisor. Tom had a question: does duty to cooperate only apply retroactively to claims in the early and safe return to work process, or does that also extend to appeals and WCAT decisions as well? Or is it just an early and safe return to work?
Yeah, again, I think there's a lot depends on that. I mean, the likelihood that a claim that's made its way to the appeal system is probably no longer in the acute phase of the recovery. So I think there's a lot that factors that could come into play there. I guess what I just want to make sure that everybody understands is on July 15th, there is the new duty to cooperate responsibility. And what we're saying is that that's not just particular to injuries that occur on or after July 15th. If an injury has already occurred and the worker's still in that acute phase of the injury, then the expectation is that duty to cooperate between the worker and the employer would happen on that claim as well. So it's not just new claims post July 15th, but a claim that potentially has made its way to the appeal system that quickly and is still in the acute phase, then I would say, yes, possibility that duty to cooperate would apply to that as well. But I think there's a lot that comes into that. So.
Thank you, Kevin. Erica had a question, and I'll just read it verbatim. Erica says, we've struggled with this service and management of claims from our WCB advisors. What is the recourse for employers if they feel that WCB advisors are not meeting the expectations of the program? And the reason I asked, Erica also had a lot of thumbs up to that, so I know other people might be experiencing something similar.
Yeah, I think if you have had a chance or an opportunity to listen to our CEO speak about, the WCB's roles and what we need to be accountable for and how we need to hold ourselves accountable to those that we serve, both employers and workers, if you're running into a situation where you don't believe you're getting the response that you need from a caseworker or the person that's assigned to the file, then I would strongly encourage you to reach out to that manager to try to get some resolution. There's an expectation that we are, being responsive, proactively communicating stuff. So I think if you feel that that's not happening, then you need to escalate it. And look, if it really is still a dissatisfaction around the service that we're providing, we do have a client relation officer where you can file a concern about a service complaint. So hopefully it doesn't get to that. If you're not getting response or the resolution that you want, I would strongly encourage that you would then just reach out to the manager of that unit and have a discussion around what it is that's concerning you around the services that we're providing.
We had a couple of questions, Kevin, on meaningful and productive work and who determines that. So Leah asked this and a couple of others did as well. In the process for determining what work is meaningful versus work that doesn't actually really need to happen, you were talking earlier, Kevin, about how we don't want employers to feel like they have to create work. Leah and a few others had a question of ultimately who is involved in that process of determining what work is meaningful. Is the worker involved at all? At one point in the draft policy, I think we mentioned that the employer will work with WCB to kind of determine meaningful work when we talk about duty to cooperate. And there were just some questions over what is the criteria for that and who is involved in that process.
Yeah, so listen, I guess I would say this. From a meaningful work perspective, what I'm trying to get across is that it has to be work that the employer needs done. So it doesn't have to be work that I find meaningful, but it has to be work that is necessary or that somebody at the work site would be doing. And so if there's work that needs to be done at the work site and I happen to be in the recovery phase of my injury and it's a type of task that I have the ability to do, it's safe for me to do, then it's meaningful work from that perspective. What I guess I'm trying to make sure people understand is that it can't just be work that nobody's doing, that I'm just suggesting, well, just come in and do this and fill in 4 or 5 hours in the day. It has to be work that's required, that the employer needs to have done. It's not about I find the work meaningful. It's just work that needs to be done at that job site and that I would have the necessary skills and it's safe for me to do while I'm recovering in my work injury.
Thank you, Kevin. This question asks, for reemployment, if the worker in their original job was paid at a higher rate and now they're in a position in the duty to cooperate process that typically pays less, which rate does the employer pay at? Do you pay at the going rate of the new position? Do you pay their original salary in their old position? Do you want to clarify that, Kevin?
Can you just repeat that? Because at first you said reemployment, so I just want to make sure I understand the question correctly. I think I do, but just say it again, Katie.
Sure, I'll actually read it verbatim. So for reemployment, if the worker was paid at a higher rate and is now in a position, sorry, my little thing just went off, and is now in a position that typically pays less, do we, the employer, pay at the going rate of the new position?
So if I'm understanding this correctly, and if whoever asked it, if you don't think I responded to it correctly, send me a note to the policy inbox and I'll follow up with you. But as far as wages go, earnings loss is always paid to a worker based on what their pre-earnings were versus what they're able to make post recovery. So if you were in a deficit position after you went back to work in whatever accommodated position, whether it's reemployment or whether it's under early and safe return to work, the difference between those two would be wages, earnings loss that we would pay through workers' comp. So if I was pre-injury making $25 an hour, I'm in some kind of accommodated position and I'm now making $20 an hour, we would certainly look at the pre minus the post. That differential then is WCB wage loss that we would then pay as as most people on this call would understand, is temporary earnings replacement benefits. That doesn't answer it. If I've missed something, by all means, reach out to me after the webinar and I'll follow up with you.
Leah wants to know, if the worker does not accept reasonable work, will WCB pay TERB until WCB clarifies the expectations with the worker? So what happens in the meantime?
Yeah, so listen, I think that gets to the situation of, as we're trying to figure out if work's available, if there's been an offer, when that work's going to happen, there has to be obviously some reasonableness around all of this. But ultimately, if the worker is being offered return to work options and accommodated type work, and they're refusing to take that, if that truly is work that they are capable of doing, then there's certainly the possibility that we would then suspend or temporarily reduce the wage losses being paid. Where this new requirement for duty to cooperate is for both employers and for workers, and so the compliance is on both sides. And the reality is, from a worker perspective, if you are being offered and you're just not willing to go, there's a possibility that could impact your wage loss that we would be paying to you.
Thank you. And Ryan just wanted some clarification over follow-ups and safeguards. So after an injured worker, in the duty to cooperate process, an early and safe return to work, when a worker is doing a transitional duty or alternative work, is there going to be any follow-up on our end, WCB, to determine if that work, those transitional duties that they're doing, is doing more harm than good for the injured worker? So Ryan was just kind of clarifying, what kind of parameters are we going to have in place for that, or follow-up?
Yeah, so listen, while a worker is recovering from their workplace injury and ideally in some kind of accommodated position, keeping them at work, there needs to be frequent proactive conversations happening with the caseworker, the worker, the employer, the whole return to work team. So if they're back in some accommodated position and it's not working out, or there's the possibility that it's not appropriate, it's not safe for them to do because it's actually a more labor intense type work than they clearly have the ability to do, then that should be all worked through the return to work team. And either then they would have to make some modifications to that return to work plan, the accommodated position, or possibly if there's nothing else, then perhaps, unfortunately, maybe they would be back on WCB earnings loss until some kind of accommodated type work can be done. The other thing that I just want to make clear, I'm not sure if I kind of got this across during the presentation, if there's no work available at the very first of the claim, and that we find that to be true, it's not that it's a one and done. The employer and the worker during the recovery are still expected to be having ongoing communications to try to continue to find possibilities of accommodations while they continue to recover. So it's not we don't have anything on day one, and then so we don't look at it again until week 6 or something. I mean, it's an ongoing conversation as I recover every day. As you recover, perhaps then the return to work accommodated the duties just continue to increase until you get back to full duties. That's the expectation.
Thanks for actually making that clarification, Kevin. That's very helpful. Tom wanted to know, and we actually had a question about this in the last webinar as well, over clarification around the acute phase of an injury. Tom just wanted to know if the meaning of the acute phase of an injury will be clarified in our policy.
Yeah, it's definitely something. We've had a couple questions on that. I think it's something we'll definitely go back and have a look at. But when I talk about the acute phase of the injury, all I am trying to get at is when you look at that chart again that I showed in the presentation and the whole return to work process, before a worker gets to some form of medical stability in their recovery of their claim, that's the whole early and safe duty to cooperate phase. So while you're still recovering, there's a duty to cooperate. After you're fully recovered, that's when reemployment, if you're not already back to work by then, that's when reemployment obligations begin at that point. So the timeline of, how long is the acute phase? Well, the acute phase is really dependent on the type of workplace injury that you may have. So, but we'll definitely go back and we'll have a look at that because it's been raised a couple different times. So.
Joanna had a quick question. Are we still able to use any provider for physio or chiro, or will it be specific clinics that we must use in duty to cooperate in the early and safe return to work phase?
You might be getting outside my area of expertise on that one. There's not duty to cooperate is not changing any of those responsibilities. So whatever service providers that people are authorized service providers under workers' comp, you should still be able to use the same thing. But if that's incorrect, I'm sure somebody in our health services team will inform me. But there's nothing in duty to cooperate that changes any of those requirements.
Good to know. Going back to a question Rachel Barber had earlier, and it was again around the whole notion of meaningful and productive work. So Rachel's question was, if work is deemed not meaningful or productive by the employer, is that a form of claim suppression? And so she just wanted some clarity around that. I'm
not sure if I understand what Rachel's getting at from a claim suppression. Claim suppression would suggest that you didn't allow a claim to get filed. So I might have to follow up with her specifically on that. I'm not sure I can answer that one. Sorry.
That's okay. I think she's okay. There, Rachel just commented in the chat and said she can contact you later to clarify.
She's got my number.
Yeah, exactly. Thank you, Rachel. I'm just going through the chat here, and so we've got about 3 minutes left, folks. So any last questions that you guys have on the draft policy, by all means, pop them in. I think I've covered most of everything at this point. I'm just scrolling through. We had some questions that were very similar, so I just kind of bucketed them together. But we've got a couple minutes left, so we do have time for one more question. So if someone wants to throw in a Hail Mary pass here and throw one final in before we end, by all means, go for it. But in the meantime, go ahead, Kevin.
I was just going to say, just as you're waiting to see if there's another question, I just want to let people know, look, typically when we're out doing consultations, we've got an end date, which this one we do as well, April 28th. And typically, we're asking people to send in their submissions. I just want everybody to understand that during these webinars, we're collecting all of this information. So if you don't have additional feedback that you feel wasn't addressed, or you think that it still needs to be sent in, you're certainly more than welcome to send in a written submission. But if your question was raised and we're considering it, we are collecting that as part of the feedback process. So you don't need to send, you're certainly welcome to, but you don't need to send in a separate submission simply because you had a question on the webinar.
That's actually a very helpful distinction, Kevin, because we did get some questions on that before. Yes, these webinars are not just an informative session, they are part of the policy consultation process. So obviously you can send in your written feedback or questions to the policy@wcb.ns.ca email. And alternatively, questions that are asked in these webinars are part of that consultation process as well. So Kevin's just me, you don't have to duplicate it. If you ask a question here, don't feel like you have to resend it to the email. And yes, we had some questions here about the recording. Our recordings are always posted to our Duty to Cooperate website. And I don't see any more questions popping up here. So I guess we'll just wrap up for today. We've got 1 minute left anyways. So I just want to thank everybody on behalf of the WCB for popping on today. I was going to say happy spring, but I'm looking out right now and it's just snowing. And I'm from Ottawa, and I remember when I moved here, people said get used to like sun in the morning, snowstorm in the afternoon, thunderstorm overnight. And I remember I used to think that was hyperbole, and it's not. It's very, very accurate. Thank you to everybody. Yeah, exactly. Leah says, welcome to Nova Scotia. It's very true. but I wouldn't want to live anywhere else, to be totally honest. I love this province, and I know you guys do too. So thank you so much to everybody who has joined us for these Duty to Cooperate draft policy webinars and just our webinars in general. We always appreciate you guys taking time out of your busy days to ask us questions, point things out, flag anything, raise concerns. And in this particular case, these sessions are part of our draft policy consultation process. So it's very, very important. As Kevin said, if you want to send a question that you didn't ask here, but you thought of something and you want to send it to our policy at wcb.ns.ca email, it's right there on the screen. By all means, go ahead. This draft policy, you've got plenty of time. It's still open until April 28th. And the recordings of these sessions are always posted to our Duty to Cooperate website. And when those recordings are posted, we send out an email to notify you of that. So if you want to go back and watch them, or you have a colleague who wasn't able to join and they want to watch, by all means, go for it. And I'm just trying to think if there's anything else I need to plug. And I think that's pretty much it. Kevin, can you think of anything else I might be missing?
No, the last thing I would just say, if you, to Katie's point, if you want to make sure that you don't miss out on anything that we're doing from a policy perspective, go to our website under the policy section. There's an ability to sign up for notifications, and then you will find out about all webinars, all consultations, anything that we're doing policy related. So please feel free to sign up. It's simple and easy and a way to stay in touch. So thanks.
And there you go. And my colleague Heather just flipped the link into the chat box there, guys. So as Kevin said, if you want to sign up to receive our policy notifications, the link is right there. And anytime we have a draft policy or something related to policy, you'll get it right to your inbox. So without further ado, I won't keep you guys from your snowy afternoon. Thank you so much for joining us today, and we'll chat again soon. Thank you, everybody.